Welcome to the Nclex success. The Nclex success today we'll look at maternity nursing comprehensive Nclex outline. We'll look at topics in here that you're going to find in the Nclex examination directly. You will find topics, you'll find rationales, you're going to find interventions, you're going to find procedures, in the Nclex, you're going to find them in here directly. And I would like for us to pay some time to Maternity because Maternity is one of the courses that comes in the Nclex. So I want us to look at it in depth. So in our classes, we divided Maternity into 4 different groups, which we're going to have day 1, day 2, day 3, day 4. In day 1, we'll talk about the general overview of the entire female and male productive system. That will lead us to the contraceptives. What are those things we could do to prevent pregnancy if we do not want to have it at a time? That's the first thing we're going to start with. We'll look at the various hormones that can be helpful in controlling pregnancy, in preventing pregnancy, in also harboring and nourishing pregnancy. There are hormones that are responsible for those different type of functions of the body in pregnancy, before pregnancy, and even after pregnancy, which is for the postpartum period. Then we'll look at calculating EDD, expected date of delivery. How do we calculate that? We'll look at that on day 1. We'll look at the signs of pregnancy. We're talking about the presumptive signs, the probable signs, the positive signs of pregnancy. Those are important things we'll look at on day 1. Day 1 will also take us to look at those physiological changes that occur in pregnancy. And we'll look at discomforts in pregnancy, talking about you having like a lower back ache, talking about nausea, vomiting. All of those discomfort you're going to have in pregnancy will be in day 1. Day 2, we'll look at the risk factors or risk factors in pregnancy. We'll look at infections in pregnancy, all of those different infections, the chlamydia infection, trichomonas, gonorrhea, syphilis. Those are all important things to look at in the Nclex. We'll look at diagnostic procedures in pregnancy. We're talking about the non-stress test, the stress test, the biophysical profile, amniocentesis, those different laboratory tests we'll do for the patient, going even looking at the glucose tolerance test. All those tests are important to look at when it comes to pregnancy. Then we'll talk about nutrition in pregnancy. What's the diet for a pregnant woman to gain weight, to maintain weight if they are overweight? We'll look at those one in day 2. Day 2 will end with medical conditions in pregnancy. Talking about bleeding, like abortion. I'll talk about hypertensive induced pregnancy induced hypertension. We're talking about diabetes mellitus in pregnancy. We're talking about hyperemesis gravidarum. All those different medical issues you're going to encounter in pregnancy will be discussed in day 2. Then we move to day 3. Day 3, we'll talk about the process of labor, meaning we've done with all those conditions. Now we are moving towards labor. Talking about those different things that occur in the process of labor. Then we go to the mechanism of labor. Then we'll have labor stages, stage 1, stage 2, stage 3, stage 4 of labor. What occur in those different stages will be our concern, will be what we're going to be concerned about with these different labor stages. Talk about obstetric procedures. They'll talk about breathing techniques in pregnancy, in labor, or during pregnancy, or during delivery. Talk about fetal variability. Talk about the different variability. Talking about they are important to look at them. Then we'll look at the graph for those different variability. And day 4, which is the last day of our class, we'll look at problems with labor. We'll talk about law care and its care, what the care we provide for patient who is a pregnant woman who has given birth and they are having law care. The law care are different kind of flow that comes from the vagina after delivery. Then it will take us to postpartum and its complications. Then we're going to have care of the newborn. Now, these topics are what we'll focus on wholly and solely for our Nclex tutorial for this chapter on the maternity nursing. Thank you very much. Have a blessed time with us.